All right, any questions by anything? There's an assignment that's coming out today, so I'll post it online today. And then it's due, I think, next Thursday, so a week from Thursday. Then we have, let's see, a couple more weeks, and then the test, I think, is like the 17th or something of October. So we still have a few weeks before the test arrives. Let's see, anything else? I think that's it. Okay. So we're talking about research questions. And what we're going to talk about basically is just like not only research questions, but also the key thing to get from today is just to get what independent and dependent variables are. And it may seem kind of trivial as we go through this today to figure these things out, but I'm telling you, it's tough, especially when you get an article that you have to read. It can be really tough to sort of figure out what's the dependent variable and what's the independent variable. Okay, so we talked about that the idea is what, when you come up with sort of a research question, is what you're doing is you're coming up with a causality, with you're saying, oh, change in factor 1 causes a change in factor 2. So let's take umbrellas and rain. You notice that umbrellas, that when it rains, people carry umbrellas. So the question is, do umbrellas cause rain or do rain cause umbrellas? Yeah, does rain cause people to bring umbrellas, or does umbrellas cause it to rain? Rain causes people to bring umbrellas. So is rain the independent variable or the dependent variable? Say it again. Independent, right? So the rain is causing people to bring umbrellas. So rain is the independent variable. The umbrella use is the dependent variable. So that means that factor 1, rain, causes factor 2, people to bring umbrellas. Now, what's kind of confusing is that, oftentimes when we're going to write basically factor 1, so the independent variable leads to the dependent variable, right? Like that. Meaning that some change, if this thing goes up, and this thing goes up or down, and this thing goes down, and this thing goes up or down. It just depends on what the relationship looks like. So we're going to talk about this way. But oftentimes, when you read a research paper, is that they write it like this. They write sort of the dependent variable is equal to the change in all the independent variables. So in research papers, they usually put the dependent variable on the left and the independent variables on the right, even though when we talk about it, we're going to talk about it going this way. Okay, so we started to go through kind of some different ones. So let's see, last time we did violence on TV. Let's take smoking on TV. You think that smoking on TV leads to more teens smoking, okay? So smoking on TV, dependent or independent variable? Independent. More teen smoking then would be the dependent variable. So which way does the directionality go? Does it go up or down? Does more smoking on TV lead to more teens smoking, or does it go the other way? More smoking on TV leads to less teen smoking. More and more. More and more. So that's why when you draw it then, is that what you're doing is that you're going to say more leads to more, like that. So you have basically the arrows going in the same direction. Okay. So then what you do is that then you have to sort of say, well, what exactly do I mean by smoking on TV? So smoking on TV, excuse me, what do I mean by basically my change my dependent variable? So in this case, then it's probably rate of smoking, amount of smoking is what we're talking about. Or maybe just attitudes towards smoking. So somehow you have to, come up and figure out what you mean by what this, what this variable is. Okay. So independent variables and so when you go through, like let's take this last one. Increased exposure to food commercial leads to increased consumption of fast food and therefore increased weight. what are the independent and dependent variables in that last one? So increased exposure to food commercial leads to increased consumption of fast food and therefore increased weight. Is the independent variable. So it goes fast food commercials leads to more consumption, which leads to more weight gain, right? More consumption of fast foods. Right? Because fast food commercial, you could see a fast food commercial for a hamburger and think, I'd love to eat some celery, right? In which case, it wouldn't necessarily lead to more weight gain. But you're sort of saying is that increases in this lead to increases in that, and then both increases in that. So these things here, so this is your independent variable. And then are both of these dependent variables, or is one an independent variable?
Be both, and consumption be both independent and dependent.
You can. So you can have things where one causes something else and that causes something else, right? So for example, like if you look at who uses healthcare, and you say, well, we think that one thing that influences healthcare is insurance, type of health insurance, right? So the more, if you have health insurance, you're more likely to use healthcare. But then there's also income. So income is associated with more healthcare use. So the question is income a direct impact, or does income mean that you're more likely to have insurance? And so therefore, if you're more likely to have insurance, then you're more likely to have healthcare. So it could be, like in this case, there is no independent relationship. It just means that income acts through insurance to do healthcare. What if you did this? What if you only, let's say it looked that way. Let's say it was only, this is the way that it looks, right? But when you looked at the relationship, you just looked at income and healthcare. Would you see association between income and healthcare? Yeah, you would, right? But really it goes through insurance like this. Well, there are ways to test this. So when you go through them, you actually do statistical tests. Oftentimes what they do is they look for mediators and moderators, what that means is that they're looking to see, does income then have a direct effect? Or does it have an indirect effect? Indirect effect means it acts through something else. Direct effect means that it impacts. And like in the case of this, income, insurance, healthcare, it's both. It has both a direct effect and it has an indirect effect as well. So it can be both of those things. But that's kind of what it means. But in each case then, so this is your independent variable. This is your dependent variable. Right? And insurance then, it's the dependent variable when looking at this relationship. That's the independent variable when looking at that relationship. Good? Okay. So let's do an example. I randomly selected student health services on campus. Anyone ever used the student health services on campus? No one else? Okay. So what services do student health services provide? How would I figure this out? So like, let's say if I said this was your question that I want you to look at, is to start looking at, to generate some research questions around the student health service. So the first thing you do is figure out what they do. So where could you figure out what they do? Yeah, on their website. Oh, and look at, that's what I did. I went to their website. And let's see, is this it? Yeah. So here it is, health services on campus. What services we offer. So here's all the different type of things that they offer. So if you were to sort of characterize what role does, well, put it this way, for you, those of you who have not used the Student Health Center, can I ask why you haven't ever used the Student Health Center?
I wanted to use their like, dental plan.
Uh-huh.
But like it just got complicated, like I had to like sign up for dental and it's a lot of paperwork.
So you said, forget it,
Yeah.
not worth it. Anyone else? Any other reasons why you don't use the student health center?
Just not enough information.
Not enough information? Well, like if you get, let's say if you suddenly got, if you got, you woke up in the middle of the night with a stomach ache, what would you do? Say it loud.
Medicine, go back.
Okay, so you could just figure out, say, well, I'm just gonna take some Pepto-Bismol and go back to sleep. Okay. What else could you do? Call someone, right? Call someone and say, is this a serious symptom or not? Could do that. Like someone like a family member, call a family member and say, I'm sick in the middle of the night. Is this a serious symptom or not? Could do that. What else could you do? Google it. You could go online and Google it. Okay. Say it loud. You could go to the doctor. Which doctor would you go to? Middle of the night, though.
Emergency.
Well, I mean, so you could wait, right? You could say, I'm just going to wait and hopefully I won't die. And then I'll, just go in the morning. Or you could go to the emergency room. So let's say if you decide you're going to wait, that you're not going to die, but so you're going to wait and go in the morning. Would you go to the student health center or another doctor? Well, like which doctor would you go to? Like on the practical level, if you woke up in the middle of the night, horrible stomach ache, tomorrow morning you have to you decide you're going to go to a doctor. Where would you go? Would you go to the student health center? How many people would go to the student health center? How many people would go just to their own doctor in Merced? How many people would go to a doctor that's outside of Merced? So outside of Merced mean because you live outside Merced or because you just have healthcare? Like your family doctors in Fresno or whatever, and so therefore you just would go there. Okay, so who is it then that's going to use the online on-campus doctors then?
They live, if you all the way to LA or further out or don't have a car, go here faster.
Right, so and is it that so if you had a choice, but let's say if your family doctor, how many people have family doctors? Have a regular doctor they see? Like a regular doctor means that if you got sick, you could call up this doctor and you wouldn't have to sign up with them. They already know you and that they could give you an appointment, things like that. How many people have a doctor like that? Okay. So how many people's doctor is the student health center? No. Yours is the student health center? Okay. For those of you who have a doctor someplace else, how far away is it? Like how many? So what's that?
Oh, mine?
Yeah.
Hours away.
Okay, so yours is pretty far. So if you get sick, then you're either going to truck on home or you're going to go to
Yeah, I just go here.
here. So other people like that, their doctor's too far away just to kind of, how many people is it close enough that you would just go to that? Okay. And then so what type of things would you go to, your doc? Well, what type of things? I mean, because you got to kind of start splitting it up. Like if you look at that list of different things, is that there's some things here that you would think, oh, I'll go to a doctor here. Other things you might go to a doctor back in your home. So for example, if you got, let's see. A concussion. Well, if you were like riding a skateboard out here, fell down, smacked your head, think you have a concussion. Where would you go? Go here? Why here? More urgent. You may not want to, concussion, probably don't want to wait 5 hours to go get checked out or even, so concussion, if you, like got a broken bone, then you'd probably go to the emergency room. Well, probably not the student health center because they probably don't do that type of emergency. But, things like that, you'd probably go off to the emergency room. Let's see, what's another one? Uh-huh. Oh, is it free here? Oh, okay. Well, that makes a difference then. Mhm. So let's take prescription drugs. Go here, go someplace else. Like if you had a prescription that you needed filled, could you go here or would you have to go to whoever prescribed the drugs to you? Yeah, you probably, I think if they haven't prescribed it to you, you'd have to go and see them and then they would have to re-prescribe it for you. So they're probably not gonna, I mean, if you already have a prescription, then, they probably don't run an active pharmacy, right? Probably what they do is they just deal with Rayleigh's and that Rayleigh's then probably is their pharmacy. So they probably just say, oh, we'll go down to Rayleigh's and get your prescription filled there, right? If you, on the other hand, if you came in there and you wanted like birth control pills, which may be over the counter soon, let's say that you wanted something that wasn't over the counter, then they might go ahead and write you the prescription and still either send you to Rayleigh's or they might say, we'll deliver it to you, something like that. Okay, so let's see. So let's pick like what type of so it means we're sort of narrowing down then when we talk about use of the student health center. We're narrowing down exactly what it is that they might use the student health center for. So what kind of things do you think in general people might use the student health center for? So it's not emergency stuff, or it's not emergency like broken legs. It's not cancer. You're not going to, get treatment for things like that. So what kind of things would on campus would students use the student health, be more likely to use the health center for? How that looks. Okay, so we'll do basically pregnancy, STD testing, or STI testing, right, probably, contraceptive counseling, probably flu shots as well, probably flu shots and, like the new COVID vaccines coming out. I bet you the Student Health Center will offer the new COVID vaccine. So basically things like this, things that are non-emergency, not things that are that require more in-depth knowledge from a doctor or more in-depth type of treatment from a doctor, but instead things that you could just walk in and get and walk out again. Does that sound about right? Yeah, so if you needed like if you're traveling someplace and you had to get a physical before you travel, or if you just, they probably do a lot for sports, for the sports teams. I bet you they give they treat the sports teams for stuff that happens. I think. Anyone on a sports team? All right. So what we're looking at then is we're looking at the use of basically now STI testing, physicals, pregnancy testing. So things along this line, okay? Okay, so now we've talked about what type of factors are going to be most likely. So if we think about our dependent variable, what's our dependent variable going to be? So it could be use of student health services, right? Use of student health services for one of these. Could be that. What else could it be? Say it again. Yeah, I mean, we'll throw that in the same category. So any type of use of any of these things. But I mean, but another one would just be attitudes towards using, a willingness to use it, right? Because the difference between between these two things is that this one requires that you actually use it. And this one just requires that you would use it. And so, why might you want to look at this one rather than this one? Well, because because really, if you want to know, how people feel about the student health services, then you may not want to limit yourself only to people who've been in a situation where they want to use it, meaning where they have used it, and instead just look at more generally, do people want to use it? The difference between these two things is, if you think about the causality, is you have your factors that lead to intention to use, or willingness / intention to use, which leads to use, right? So that's the kind of the pathway. Well, this thing can break down. You can have intention, willingness to use, but not use for various reasons. And then people are going to differ in terms of these factors that lead them to have differences in terms of willingness to use. Right? Following it? Okay, so now let's go through and figure out what are some factors that influence willingness to use and use. Quality of, so perceived quality. Quality. What else? Yeah. Okay, so knowledge.
Really, probably 5 months ago.
Yeah, well, availability may go over here, right? Because you could want to use it and say, yes, I'd be willing to use it, but then find out, but then it's not available. So availability, and by availability, do you mean like hours that's open or just distance to it, or?
Hours that's open, and there's like a queue, like a very long queue.
Hours open? Other factors?
Convenience,
Meaning,
like, I was talking about if it's like sort of distance or.
so close, whether it's close or not. Cost?
Honestly,
Yeah, that probably goes over here. I mean, because that's probably gonna be. Privacy goes right here. I mean, who else might? What are we missing? Well, probably me. Right, who is it that's likely to need it? I mean, that actually, because I could have a willingness to use all these things, but I'm unlikely to use it. So who is it that's likely to actually go from willingness to use? Is that what? Yeah, students, but more specific, but I mean, I think it's all students. I don't know staff that use it. No. Where do you go down, see if you can get in that student health center?
I know that I can,
Yeah,
yeah,
I asked them one time, whether, because I thought, oh, students health center, I don't have a doctor in Mariposa. So therefore I thought, well, I could be, I could just use the student health center as my primary care doctor. And they said, no. So I think I can use it, like, if I smack my head and got a concussion, I could use it, but I can't use it as a primary care doctor.
And then the students don't have cancer.
Okay, so that means like lack of, because there could be on campus in terms of just closer. But then also on campus, like you can't get it anyplace else. So, because it could be is that it's, you live away, but you love the thing, and so you live in the company. Or it could be is that you hate the thing, but it's only here, you don't have a car. And so trying to get someplace else. So it's the distance, availability of other options. Then for people, I mean, who's likely to use it more? Well, probably, people who needs, let's take STI testing. Yeah, no, not everyone. I mean, who's more likely to manifest status? The people who have lots of partners, right? So, you know, the sort of the characteristics of the individual.
It's also the concept, like pregnancy test, the woman, and everything else.
Yeah, so if you're, you know, gender. If you're an athlete. Right, because if you're an athlete, then you're more likely, probably more likely to be physical and things like that. So essentially what you're doing is you're sort of going through and identifying in this case, all the different types of independent variables that that would lead to your dependent variable. So what you've done is you've sort of said, oh, here, just raise one of those on my. So you said, okay, so you have independent variables. Just pen's not working. Independent variables. It's a quality, knowledge, privacy, etc. And then you have the willingness. This is independent or dependent? Yeah, we're in this relationship, it's a dependent. Dependent variable, and then you have time. For these things, then you have like that. Wait time. Cost. Distance. And other options. Characteristics. Well, I'm just talking. Need. Or need could be, you know, basically the character, like either you're an athlete or you're something, you know, or you're someone with multiple partners, whatever it's going to be. So you've got some type of need variable. And then let's see what else. And then you have the use. The use is also a need. Okay. And the use then, how would you, so use then is just use of the services. One or more. Use of services. That look right? Okay. So now you've gone through and you sort of have this initial type of model where you've identified your factors. And now what you do is you kind of specify the relationship, and then that's your hypothesis. So given all these things, first off, do you have to go through and make a hypothesis about each of these different things? Or can you just pick out one of these, you know, one of the factors and have a hypothesis based on it? Yeah, you can pick one. Yeah, you don't have to go through and have, you know, and test all of these things at once. So you can just sort of pick out one of them. So what would you like to, what would your hypothesis be? Yeah. Okay. Be more specific.
Maybe like athletes
Okay.
or like players.
So athletes are more likely to use health services than non-athletes. I learned long ago is never spell at the board. Never do math at the board, never spell at the board. So what I write badly because then I can sort of just, you know, hide the fact I'm a horrible speller. Athletes are more likely to use health services than non-athletes. That's one. Another one. How about one just based on using willingness as your dependent variable?
Wait time. Impact.
Well, you could do that one, that's using. Would wait time be an independent or a dependent variable in that case? Yeah, so you could do another one where you say, longer wait times lead to less use. You could do that. How about one though with one of these things as your dependent variable?
So vehicles remove wait.
Are more likely to have positive attitudes. Because we want to use, willingness sort of positive attitudes to the health services, that's our dependent variable. So who's more likely to have positive attitudes about health services? What factors are likely to lead to it?
And the provider and 2 hours away and
Yeah, it gets kind of tricky because you could sort of think, I mean, I could hate the student health service, but it's the only one I have. So therefore, you want to, so I mean, there's two different things going on. One is willingness to use it, and the other one is how much you like it and what you perceive it. So you could sort of say, I think it sucks, but I'm going to use it because there's nothing else there, right? On the other hand, you could say, I love it, and so therefore I'm going to use it. So probably you need to separate out the attitudes toward, the other options or things like that from the willingness to use it, yeah.
maybe like students will have one another when the student at the center are willing to use it.
Okay. Students with more knowledge like that services in the student health center of the services offered by the student health center are more likely to think positively about using student health services. That sound right? So what you've done now is you've stated this as hypothesis. So then you have to start refining. So let's take well, let's do this one. Okay, so first thing is, so we do the who, when, and where. So in this case, who are we talking about? Be more specific. Like Rudy, is Rudy, you're a student, would Rudy be included in this? Do we care about Rudy? About his attitudes for student health center? I don't think so. Maybe just students on campus who live on campus. Should we restrict it to that? Yeah, because I mean, it's a question about, well, so who do we really think are going to use student health services? I mean, and so we could do it for the general group, right, for everyone. But then on one hand, if you have a doctor here in Merced, or if your doctor is close by, is that you're probably never going to use the student health services for things like this because you'll have your own doctor. So, you could do the study, you could include everyone like that and just give a general view of student health services. But if you wanted to find out who actually was going to use student health services, might use student health services and just focus on them, you could do that. Why would why might you want to just focus only on students who might want to use it? Like if you're the student health service, who do you care more about? And I mean, you care about everyone, of course, but whose opinion do you really want to know? Do you want to know the opinion of everyone or of students who are likely to use it? Well, give me an argument both ways. So why is it that just students are why would you care about students who are just likely to use it and not the other group?
Their primary focus is students that use it, so they need to have their inventory or their time around students, to schedule and students' needs.
Great, that's perfect answer. That's right, because it could be is that the students who are on campus who are going to have different needs than Rudy, right? So therefore, why set the whole service for Rudy when Rudy's never going to use it? That's one way. Why might you go ahead? What's the argument the other way for why it is that you might want to just include everyone's views? Yeah.
Because you kind of want to find out why they're not, and then like lean towards making them using them. So you
Yeah.
want to know that person.
Yeah, and all students have to support it. And so therefore, if you go through and you just mix out, if you only focus on the students who then it becomes sort of a very niche service, and so other students may not use it because they don't think it's appropriate for them, or they may not support it when it comes time to continue to click the little box that where they put money towards from your fees towards it. Yeah, so you can sort of see either way, and it's a choice that you make as a researcher. You can do both, right? So you can go through and you can do everyone, but then do a separate analysis just for students who are likely to use it rather than not. So you can do both if you want, or you can pick one. You can pick one or just pick the other. So which one you want? What do you think? Everyone. Okay. We'll pick everyone. Okay. So you're going to use all students, even grad students. Okay. All students, including grads. That's the who. When? It's like, how would you go through and, when would you go through and assess people, and what type of time period are we looking at for basically? Yeah. So say it again. Oh, flu season. Okay, so you might pick a time when it's more likely that students might need it, as opposed to summer when students aren't here. So okay, so you pick a time. So the who, the when, sorry. Yeah. Oh, winter. Flu season. I mean, maybe what you want to do is like November, so at the start of flu season, so that you can get a sense about what, since we're looking at intentions, you can get a sense about what it is that people might intend to do. And then the where this is student health. All right, so now you've nailed down a bit more in terms of who it is that you're talking about. Now you have to figure out, okay, so when we say, this is our dependent variable, right? Positive views. So how would we measure that? How would you measure it? And what do we care about?
Around the students, I know they know when they might.
Okay. So you could ask them, you could first, like for knowledge, you're going to assess knowledge by so how would you assess knowledge? Yeah, but I mean, like what questions would you ask? Yeah. So that's a use question. right? So you could get use question, but you want knowledge.
You could like list all the services and then more, and then ask them to check what the student help center, what those services are.
So you give them a big, long list of things and say, which things do you think, which of these services do you think that students, in student health services list? So you have a big, long list. List the potential services. And then they check. They check which ones, right? And so then what do you do once you have that checklist? Get the number right, or the percentage right. So you could get the percentage correct. You could also just ask them, give a don't know. So you could say, like, show a big list and say, yes, it's offered. No, it's not offered. And then, or I don't know. So, no. You could do it that way, and then look and check all the way through. And then, so you can count up the number of times that they're correct versus wrong, or you could look at the number of times they say don't know. Okay. So then, how would you measure attitudes for the health center?
We're still,
So, and what type of question would you ask?
questions of the health center, for this.
Yeah. I mean, do we want to know more about, because, we've identified all these factors that actually lead to it being kind of a positive thing, right? So quality of care was one. At least some of them. Quality of care is one, privacy is another, other things like that. So do we want to go through and measure kind of those types of how they think the student health center rates on these types of things? On all of these? Or just knowledge? So what if someone doesn't know about the student health center, right? Would they be likely to use it? No. So knowledge is definitely a factor, but it's probably not going to be something whereby, like for example, let's say if you found people who are not knowledgeable and said they're not going to use it, that probably wouldn't surprise you. But you might find people who are knowledgeable who then still don't want to use it, right? So in that case, then why might people be knowledgeable but still don't want to use it? And maybe because of these things.
Yeah.
So in a way, knowledge becomes kind of a factor out here someplace. Right? Knowledge, and that because if you have no knowledge, then you're not gonna have any application towards the student health center, right? Like if I said, how likely or how do you feel about using a health center in Wichita, Kansas? If I say, I don't know, okay, because you have no knowledge about health centers in Wichita, Kansas, right? So knowledge has to be kind of something that is a sort of a prerequisite to this. So would that influence then what you do here? Or does it change what your research question is? Yeah, because there's the first question is that, well, who's going to have more knowledge? Right? What leads to students having more knowledge on? And then the second question is that if you have knowledge of it, then how do you perceive it? Because from a student health center standpoint, those are two separate things that, like, if you find that no one knows about it, then it says, you have to go advertise tell people what you have, right? On the other hand, if you find that everyone knows about it, but no one wants to use it, then you have to ask yourself, well, why is it that no one wants to use it? So it means that you can have a knowledge question. And then the knowledge question sort of breaks into two different parts, right? So no knowledge versus knowledge. And then you ask yourself, all right, so what is it that's going to predict who has knowledge versus no knowledge? So probably, prior use. It's going to be something that affects whether someone has knowledge of it. But what else? What else is going to determine, like how many people have known this was the first time they've ever looked at the list of what the Student Health Center has to offer? You been there? Okay. Well, okay, but how about who is it? How would you rate, show me by your thumbs, how would you rate your level of knowledge about the Student Health Center? From pretty good to okay to know nothing about it. Okay, know nothing about it. Why do you know nothing about the Student Health Center?
Never really looked into it.
Why not?
Never explored the resources the school has to offer.
Yeah, but I mean, have you ever needed it? No. And if you needed it, is there someplace else you could go to?
Not anywhere to go.
So you're just, so I mean, because that's an important thing, is that there's some people who have no need, right? No need for it. And so therefore, that's going to probably be a predictor of who has knowledge or who doesn't have knowledge. Maybe. But you can see what you're doing now is that you're thinking, you're sort of figuring out how to go through and separate people out into these different type of categories. And then once you have those categories, then, you've got one question, which is that who has knowledge? And then the second question is that for those with knowledge, what leads to willingness to use it? Because I might know about it and hate it, right? Or I might know about it and be willing to use it. So I think that this thing really sort of it sort of presupposes that we have to figure out who has knowledge or not. Right? Okay, so you've done that. So now you've separated out and you say, we're just going to look at people with knowledge. So how would you assess these things? How would you, like quality? How could you assess quality? What's your perceived quality of the student health center?
When students exit the health center, you can ask, what do you see the quality, and maybe have a list of questions.
Well, it's a question about, do you want to go through and just, because if you want to only ask people who have been to the student health center, or do you want to ask people who know about it but haven't been? Because I think, because I think if you ask about quality, then when you sort of say, well, who is it that's going to have different views of quality? Is that it's probably people who have used it versus not used it, and they may be higher or lower, but they're going to have different type of views than people who have never used it. Like if you ask me, what's the quality of services at Mercy Hospital? I'd say poor, or fair. I'd say average. Average at Mercy Hospital. I've never actually used Mercy Hospital. Never been in there. But I've heard things and such like that. So I just have this idea that it's an okay quality. If you ask me quality of John C. Fremont Hospital in Mariposa, I'd say bad, because I've heard things, but I've never been in John C. Fremont Hospital. On the other hand, people who use the hospital, do they tend to usually have higher or lower ratings of quality than people who don't use it? It depends. A lot of times, the people with the worst ratings are the ones who use it the most, right? Depends what your experiences are. So they tend to have much more definite views than people who don't use it. But the point is that people use it are going to be different than people who don't use it. Okay, so that means that you've got one type of question, which is that who has knowledge, and then you separate out those people who have knowledge. So you've got this list of options. You figure out maybe a certain percentage of people who answer yes, or get things correct. And that then you look at them and you see their perceived qualities and their perceived privacy, ratings of privacy, and then you go through your dependent variables, willingness to use, attitude towards the health center, or willingness to use the health center. Does that sound right? Okay. So now after you've gone through this exercise, now you refine your hypothesis. So the hypothesis now is not just, will students with more knowledge of health services, blah, blah, blah. It's, your refined hypothesis that, for students who have knowledge of the health, of the student health services, these students with higher ratings of quality have higher ratings and willingness to use. Something like that. These students with higher ratings of perceived quality higher or higher willingness. Okay. So for students who have knowledge, so we're separating out just the students who have knowledge of student health training. Do students with higher ratings of perceived quality have higher willingness to use? That becomes your research hypothesis. And then the next thing you do then, once you've done it, is that you can decide upon your design. So we'll decide that we just want to do a survey of the general population. So we've done that. So if we do a survey, then that is not an experimental, that's an inferential study, right? Or an observational study, where what we're doing is that we are just surveying people rather than experimenting. And then you do with the operationalize your definitions. So in this case, how did we operationalize? Remember, operationalize means that's where you get real specific about what exactly we're talking about. So for operationalizing students, how did we operationalize it? How do we decide, who's the student that we're gonna survey? Is really a student? Yeah, those who are enrolled in at UC Merced, right? So we have enrolled at UC Merced, meaning not former students, not students who are enrolled at Mercy College, but rather students who are currently enrolled at UC Merced. Okay, we've operationalized that. How did we operationalize knowledge? Yeah, we had a different one. Right, we had a checklist. We had a checklist of things. And so we have this checklist to identify services. And what, so we have a checklist of, let's say, 30 different items on it. They go down and they check which things a student health service offers. Okay. How do we decide who has knowledge about? Like what percentage of different types of of correct answers are we going to assume is knowledge versus not knowledge? 50%? 60%? 40%? What do you think? Why is that? More than 50? Why not 90?
I want to people that get 90 very well.
Yeah, I mean so you could do it, you could come up with a standard, like 75%, something like that. And just say, well, we think, they should be able to identify 3/4, but that's our definition of knowledge. You could just split the sample. So what you could do is you could just take the highest, see how many people, the average number correct, and then just get the highest number of people in the upper part, they're knowledgeable, people in the lower part are not knowledgeable, to do it that way. But you have to come up with some way of doing this, of figuring this out. Higher ratings of perceived quality. How would we rate perceived quality? Like, how would we sort of measure? How do we operationalize perceived quality? Yeah, we could just ask them, like, what do you think about the doctors? What do you think about even if you've never used the services, what's your perception of the quality of the doctors at, in the clinic? What's your perception of what the, because, doctors is one thing, but what's your perception of the way that you're treated in there? What's your perception of, so you could have these different types of measures of what quality means. You have to figure out the measures of quality. And then willingness to use. How would you assess willingness to use? Because you could just ask them, on a scale of 1 to 10, how likely would you be to use the student health services? Could ask them that, right? But probably you want to be more specific. Because, we're not interested, like, for example, if you just ask them that question, then people might be thinking, well, I guess if I got a concussion, I'd be willing to use it. But if I needed cancer care, I wouldn't be willing to use it. So you probably have to be more specific. So how would you get more specific with that? In the case of, you could ask them any, right? So you could sort of say, is it the first place that you go to if you needed to? You could ask them that. You could also say, suppose that you hit your head. You fell down, hit your head, and you're worried about concussion. How likely would you be able to? Yeah.
How might it be used if, and then put not like an example, but emergency care, and then put in right? Like cancer or something very serious, and then put non-emergency and put like the small bruise. Maybe
Yep. No, that's right. So you could ask different types of, you could, break it up into different categories, right? So emergency care, non-emergency care, like, non-emergency, like, cuts and bruises. You could have, counseling for pregnancy counseling. You could ask for each of those different things. You could ask different willingness questions. Would you have to go through and revise your quality questions then? If you ask them that way? Yeah, I think so, right? Because this was just sort of general, what's your quality of care, right? But it could be is that you think that, well, they're really good at student mental health issues, but they're really bad at emergency care, let's say.
Put it side by side, and then the quality of this, whatever we put there, and then we do what we can.
So, what you're doing at this point now is you're starting to really operationalize, really come down to exactly what it is that you're going to do for that. So when you're done then, and you make null, so once you have this, you turn this into a null hypothesis. It's like, what would the null hypothesis of this be? What would that, so for students who have knowledge of student health services, do students with higher ratings of perceived quality have higher ratings or higher willingness to use? So your hypothesis is that students with higher ratings of perceived quality are likely to have higher ratings of willingness to use. Right. That's your hypothesis. So what's your null hypothesis?
In order to students have knowledge or not, they don't use the
No, it's, well, I mean, if you use this as your main, but we're picking out students with knowledge. For students with knowledge, the null hypothesis would say students with higher ratings of perceived quality are not more likely to have higher willingness to use. That's your null hypothesis. So I'll write it down and I'll write it too. So you're. The hypothesis is that for students with knowledge, students will have higher perceived quality of care or student health services. Will have higher willingness to use student health services. Okay, that's your hypothesis. And then your null hypothesis is that for students with knowledge, students who have student quality care illness. Is that clear? All right. Okay, so we just went through an exercise for how they're coming up with a research question. So now let's take a step back and sort of say, where did this come from, right? How did we do this? Well, what we did is that you kind of used your, your kind of knowledge about why students use health services, and then try to, from that, put together this theory or this package for how things might work, like this flow. Now, in reality, if you're really to do this as a research project, is that there would be kind of a couple different ways that you might go through and figure this out, right? Of coming up with this. So one is observation. That's kind of what you're using. So you're using your own type of knowledge about it. A second one is theory. So, the theory being is that, well, there's actually theories that explain why people, how they go from deciding to use health services to actually use them, or what factors influence it. So you can have theory. And then the third one is qualitative analysis. And qualitative analysis is it's a type of research where the whole, where the purpose, at least for the purpose of what we're going to do here, is basically how to generate research ideas. So I'm going to send you, when we're done here, a couple papers. There's this one here. Barriers, enablers of sexual health services use among university students, qualitative study, that one. And then this one here, prevalence and predictors of complementary alternative medicine use among Ivy League college students, implications for student health services. Why these two papers? Well, because so far they're the only papers I could find that deal with qualitative studies of student health services, use of student health services. I'll continue looking, but so far this is what I've come up with. So what I want you to do between now and Thursday then is basically read these papers, and then we'll go through them in class on Thursday. And what you'll see is that they're kind of structured similarly to what the other ones are. But they have different type of things, like they have, I'm gonna get rid of this. They have, basically quotes in there and things like that as well. So read them and then we'll discuss them on Thursday. Good? Any questions? All right,